Recently, the first case of polio was reported in over a decade. The CDC confirming that at least one adult who was not vaccinated for polio tested positive, and that person experienced temporary paralysis. The bigger concern is a potential outbreak, and there is wastewater data showing that there could be a large outbreak already happening within that community in the state of New York. So we're joined again by our 9Health expert, Dr. Payal Kohli, and we thought that polio had been eradicated. As a matter of fact, we no longer vaccinate or take oral medications to prevent polio anymore, do we?
Well, we actually do vaccinate, and that's how we had eradicated it here in the United States. In 1979, they said it was eradicated. Now, in some countries like Afghanistan and Pakistan, it's endemic because they don't have access to medications, to vaccinations. But here in the U.S., where we had the access, this is shocking that it's back after so many decades.
So, we have been hearing about this a lot in the last few days. What are the symptoms, first of all, because you'd want to know that. And it can be really serious. It can be life-threatening.
It can be. In fact, you all know the pictures of FDR sitting in his wheelchair. That's post-polio myelitis. So polio itself is a virus, and it's spread from person to person. It's usually spread through fecal-oral contamination. In other words, it lives in our mouth and our intestines. So if you get in touch with contaminated wastewater or even droplets, sneezing, coughing, you can spread it to someone else. Most people with polio are asymptomatic.
Oh,
in fact,
so
70% or more, yes, can be asymptomatic, so they don't even know that they're spreading it. And polio can progress, as we talked about, to cause paralysis, to cause meningitis, which is inflammation of the lining around the brain and the spinal cord. And even many years after the initial infection, you can end up paralyzed with post-polio syndrome.
Tuesday, Dr. Kohli was nice enough to tell me that I was safe from monkeypox because I'm old, because I got vaccinated for it, which we don't do anymore. Many of us are vaccinated against polio. Are we safe?
That's right. We are safe. So thankfully, if we got completely vaccinated, which for adults is 3 shots, for kids it's 4 shots, there's a 99% efficacy of that vaccine to protect us, and it's pretty much lifelong protection. The person and the people in New York that are getting it are the ones that haven't been vaccinated, and that's why it's researched. Now, there are some of us who should go get a booster, and those are the people that may be at high risk for exposure because of travel to endemic countries, or they're working with polio patients, or they're coming in contact with that wastewater.
So as we hear this, I mean, I know there are a lot of people that don't believe in vaccines. And I remember meeting a man years ago that got polio as a child, and then it led to lifelong issues. What would be if you could get on your soapbox to somebody that doesn't believe in vaccines?
You know, we have a disease that we had eradicated, that we have no treatment for, that leaves you paralyzed, and we have a prevention for it. Science has opened the door for us. All we have to do is walk through it. And in my mind, not getting the vaccine or not giving your child the vaccine is the ultimate form of apathy. And it's really a dangerous trend because it's not just polio. We're talking about other conditions, smallpox, other really severe illnesses that we could start to wake up again that we haven't had to deal with.
These are things we haven't heard that much of until a couple of years ago. And now do you worry about people becoming a little deaf to the sound of vaccines for COVID, a monkeypox vaccine, polio, you need to be vaccinated? Do you think people are going, no, I'm not going to go get all these shots?
I think there's so much vaccine fatigue, and I really worry about that because as a physician in my career, I've never treated a case of polio. So I'm not even sure I would know how to treat a case of polio because I haven't seen it. But the opposite side of that coin, Tom, is that every single theme is the same. Preventable illnesses, preventable with something as simple as a vaccination.
Is there any way someone who's asymptomatic should be aware that they may have polio or may have been exposed to it? Is there a way, or do you simply have to be, how do you get tested if they're...
So there are tests. You could do blood tests to look for antibodies, but if you've had a high risk of exposure to polio, you absolutely should call your doctor, and that would mean the wastewater, that would mean a public pool, for example, like in New York City, New York State, going to pools where they might be contaminated, and you haven't been vaccinated. It's absolutely important to make sure you get tested so you don't expose others.
Well, it's something we're starting to follow again, and we'll be following the case from New York and certainly keeping an eye on things here in Colorado as well. But another thing we'll be paying attention to, and we appreciate you keeping us up to date on it.
We'll talk to you soon. Flu shot will be coming up soon.
That's right.
When you say all these vaccines.
Yeah.
Okay.